Hi, I'm David Sherman. Welcome to Rogers COVID-19 special programming. I have with me Dr. Ian Arra, who is the Medical Officer of Health for Grey Bruce. Dr. Arra, welcome. Good to have you here this morning.
Thank you, David. Always good to be here.
Now, today is Thursday, the 26th of March, and you have some information for us. Do you want to begin?
Certainly. So today, in the middle of the response to COVID-19, we decided in the health unit to assert the federal request for under the Quarantine Act for international travelers coming back to Canada to stay at home for 14 days. So in the capacity and my authority as a medical officer of health for Grey Bruce, I issued an order for all returning travelers who are going to be coming to Grey Bruce to abide by the requirement. And this order would means people need to self-isolate, specifically stay home, not go out of their home or place of residence for 14 days. If they need to run any errands, they can use the phone, the internet, contact their friends, family, other support network that they would have. And this strong recommendation and order are basically as a response to the feedback I received from the municipalities in Grey Bruce and from the public. People are concerned about travelers who are coming back and just going about their business as if there is nothing else, as if there is nothing happening. Multiple municipalities have declared emergency. The province has declared emergency, and this is a serious situation that I would want people to keep top mind. And again, we depend on the majority of travelers to do the right thing. However, if people didn't comply, the order would allow police services to enforce it.
This is probably the most serious response that I have ever seen. I am well aware that there are people in the area who are returning as either from the United States or from other parts of the world. And the majority of people are indeed self-isolating and taking appropriate precautions, but there are some, unfortunately, that aren't. And you're making it very, very clear that there are serious consequences if you are a traveler, if you have returned to Grey Bruce to home, or if you have been, well, the scenario I'm thinking of is given somebody's cottage and they've said, go isolate there. Well, you really do have to isolate, don't you?
Certainly, and more specifically, David, what I'm concerned about, and I would go full blast, people who reside in multiple dwelling, condo, apartments. The apartment itself is a private location. However, the common areas in the building are not. It is in the public domain, and again, the order would be enforced full blast in these areas. It's very inappropriate for somebody to come from international travel with higher risk of transmitting the disease and to go through these facilities, whether it's laundry or lobby, with regards to the well-being and the health of other people. So again, this is something that would be enforced, and the order is to the individual themselves and to the building owners and management to ensure compliance in their buildings.
You make a very good point, because people are returning from overseas or the United States or from South America. We learned today that there are still flights being brought in to repatriate Canadians. But if they go back to a condo and start walking around the halls, that's not a good scene for preventing COVID-19, is it?
Certainly not. And a part of that order was a strong recommendation for social isolation. So the social isolation is not an order, it is strong recommendation, and it really is in line with the declaration of emergency from the municipalities, from the province, and it is for the well-being of our community and residents and visitors, including visitors. Any social action that's prevented would decrease the risk of transmission to the people in Grey Bruce, and most specifically the older adults and vulnerable population with comorbidities. Those are the sub-community that we all need to protect. And again, my order, the order I issued, and my strong recommendations would go to protect that group. And we hope people would do the right thing. However, for the people who are not going to follow these orders, the enforcement is in place for it.
And I think that people need to know that the depth of consequences for ignoring this order, they were outlined by Minister Haiju yesterday, and it runs into years in terms of prison and significant fines of millions of dollars. I mean, the government is very, very, very firm about this. You won't get a slap on the wrist, I doubt.
Yeah, that's one way to put it. The orders under the Quarantine Act would come from the federal government. The orders that came locally from the MOH, myself, and that and some other MOHs in their areas, these are under the Health Promotion and Protection Act, specifically under Section 22 for infectious disease and Section 13 for health hazard. These would carry different type of penalties. And again, we hope we're not going to be using them. We're not going to be enforcing them or going with fines with them. However, they are in place if the police services need to enforce them. And David, the second part of the recommendation, the communication has recommendation about stopping all non-essential travel to and from Grey Bruce. This is not the time to have a vacation. Many businesses are closed for a good reason. Our area has emergencies. It would be very inappropriate to see somebody just going about their business as if it's a vacation. Again, we discourage non-essential travel to everybody, our residents, our visitors. If somebody is in place, stay put in place. It's not the time to drive to Grey Bruce. It's not the time to drive from Grey Bruce somewhere else.
It's interesting you would say that, Dr. Arra, because I have heard people say, gee, maybe I'll just go for a drive. And I suppose, is there any risk in going for a drive for within Grey Bruce, for example, and not getting out of your vehicle?
There's no risk. I'm using the word drive loosely. I meant somebody is going from another area to our area to a cottage. So basically moving themselves to their residential secondary residence, or somebody from Grey Bruce going on a vacation to a different county or different part of the country. This is not the time for it.
Or thinking they could find a bargain at some shopping center, which is closed.
Well, the going out of house for social distancing is not an issue. Social distancing is not a person, being locked up in their place. Rather, reduce any social interaction or physical interaction with any other place. If somebody want to go for a walk, that's recommended. But don't go for a walk where you're going to go to a spot and you're socializing with 6-7 people and having beer in a friend's house or somewhere else. The surfaces you're touching with these other people is a vehicle for transmission. Going about.
That's one of the reasons why Bruce County has shut down their trails.
Correct. And there are multiple reasons. If there's any injury on the trails, it's going to hold an ambulance in the coming times where ambulance is well needed. If somebody is needing to go to buy grocery, yes, please, by all means, we all need to eat. But there's no need to go 6 times a week to the grocery store. Let's make it one time, and we'll be intentional about going there, wiping the cart, wiping the door that's we're going to push. Making sure when we're dealing with cash, we have hand sanitizer on our hand, preferably not to deal with cash, rather a card, touchless. So all these things would go all the way. Self-isolation for residents in general is not staying at home permanently, rather reducing social distancing. And this is different from the other staying at home for people returning from international travel. This is stay at home. Don't go out of your home. Don't meet with people in your home. Don't invite people into your home. If you have any errands to be done, the phone, the internet, friends can do it for you.
Great. Well, Dr. Arra, is there anything more that you want to say? Any special messages you have for us today?
There is one message that's going to make me sound like a broken record, but that's the only way to do it. I do believe what's going to flatten the curve is nothing but the message, the teaching we received from our mothers and grandmothers throughout our life. Wash your hands, cough in your sleeve. If you're sick, stay home.
Sounds like a really good bit of advice, Dr. Arra. Thank you again, and I'm sure we'll be talking in the future. Thank you very much. I'm David Shearman. I'm David Shearman. This has been a COVID-19 special from Rogers TV.